From an industry level, we definitely don't have enough nurses because in a Malaysian context, our nurses are also going overseas.
Bila kita datang kerja, kita rasa gembira. Macam, ada orang sayang kita. So, kita pun kena sayang juga.
Betul kata you. Orang ada sayang. Itu begitu important kan?
Yeah.
Okay. So today, Seoul Cities takes you to Care Concierge, a luxury assisted living home guided by Martin Yap, one of the founders and directors of Care Concierge. He took us around the place and showed us what his concept of assisted living comprised.
Hi, Jia-Ping, welcome.
Thanks.
Welcome to the Malaysia Ampang. Yes. I'd like to show you around the space.
Right.
This is a very campus model kind of model. But you can see that this place is actually very green.
Yeah.
When we took over this place, we actually did a bit of renovation to create this kind of canopy space.
Yeah.
So it used to be a Yayasan Seni. It used to be an art center.
Okay.
Right? So when we took over it, we felt very eclectic, the environment. And all our centers are a bit more homely. Right? So the only things we did was that we did this as a new block and we actually built around a lot of the plants, the trees.
So I really love the trees. Gives a really lovely homey feeling.
Yes. Yeah. So this is the main building.
Right.
But as an extension, this is an entire new block. We can fit about 15 packs. So all together, we can fit about 60 packs in this environment. But it's also very campus style.
Right.
So the idea is that you've got a nice courtyard, people can hang out here. It's very popular with the families to come. And then of course we got little huts here. So we've got the physio spaces, our kitchen, and then a little clubhouse as well.
Right.
Yeah, you can do barbecues and things like that.
Yeah. It was really lovely and an eye-opener to see a home that was full of integrity and full of respect for the well-being of the residents there. And some of them were just alone and needed to live in a place with assistance. Some of them were suffering from dementia or Alzheimer's, and they needed really 24-hour care of both medical as well as caregiving. And also what I really liked was I learned the difference between caregiving and medical nursing care. So Martin helped to really explain what were the different concepts. And I think that actually not only do we need more medical nurses, trained nurses, but we also need more caregivers in Malaysia. So one of my concerns as an aging person in this city is how can we make our cities more friendly? How do we make sure that it's easy to navigate and walk in the city without too much trouble? And the problem with most of our cities is they're not great for walkability. You sometimes have sidewalks that are too high, or pavements and sidewalks that are broken up, so there are trip hazards everywhere. It's very difficult to manage if you have bad knees or you have some sort of walking disability. So I wanted to explore how we can navigate or build cities better for the aged. Also, if you are aged and unable to actually navigate the city, what then? Are the sidewalks built to have 2 or 3 people walking alongside an aged person as a means of assisting them to navigate the city? What does it mean if you're aged and you can't live alone any longer? And what does it mean for the family dynamics to be able to afford healthcare or assisted care for their aged relatives? So I'm trying to unpack all of this in this episode today. So Martin, thank you so much for being here and letting us come into Maison Richie. Before we start, maybe you could introduce yourself and tell us a bit about yourself.
So my name's Martin. I'm a co-founder of Care Concierge. We started about 8 years ago, and our tagline is Senior Living Specialist. And our goal is actually to help families to navigate the complexities of aging and then to give a solution.
What made you set up Care Concierge?
So it's quite a personal thing for myself. Actually, my background is, I have nothing to do with healthcare. I'm actually an architect. I actually come from a family of 4 architects.
Wow.
3 siblings, myself and my brother and my sister are architects, and then we followed my father, who was an architect as well. So nothing to do with healthcare.
Right.
But I think design was something important. So actually, the story started a lot earlier. Actually, my grandma, when we were young, she had a stroke. And it was really difficult to find help in care. I know we went through a very difficult period. She actually had 2 strokes, actually, right? And the process was difficult to get her rehabilitated. And, I saw my mom and dad really struggling to do that. And that was quite a while ago, and then she passed on. But it was always in my mind that it was very difficult to get care. I was in Australia. I was actually studying architecture in Sydney. And then I got a call back from my father who wanted to actually do a retirement home.
Right, okay.
Yeah, so it was one of those very interesting urban projects that he wanted to do about 10, 15 years ago. And I got involved to do a lot of research, found out about the aged care, especially in Malaysia. One of the reasons that he wanted to get involved as well was to change the paradigm, right? And talk about what kind of retirement for himself and his friends. And also from experiences of taking care of my grandma. Unfortunately, that project didn't really take off, but it was also lingering in my mind. And then 8 years ago, we had an opportunity to actually, or to kind of look at, I guess, entrepreneurship for myself. And also to ask what's the big issues to solve. And of course, aged care is one of those things that it's always been in my mind. I've been looking at it many years and realized that, a lot of things that I mentioned, the care, the quality of care, finding help, it was all struggles that still happen. I also got my partner, who's another co-founder as well, from my high school, incidentally. To say, look, let's do something, really help out with the society, also help out with our families as well. Everyone's aging, and is there something we can do?
So what's the paradigm shift that you actually wanted to do, and is it now being achieved by Care Concierge?
Yes, I would say we have to a certain extent. I mean, it's a journey. I think our goal is always to improve the quality of care. And in fact, we have a few more verticals than we had before. So, of course, one of the things that we do is we provide home care services, so sending caregivers to the home. That alleviates a lot of the stress for the families, and also taking care of, the seniors, and also those that do post-hospitalization. And of course, my passion in architecture also meant that design was important. So that's why we actually ventured into building the first mansions, and now we've got 9 centers.
Wow.
And growing.
Congratulations.
Thank you. It's really about the team, but the goal is actually to build an environment for seniors to enjoy, something a bit different. So one of the challenges that we were looking at to change was also the kind of a paradigm shift in mindset that we always talk about old folks home, and the kind of quality of care that you have, some place that, that people get abandoned to. But it doesn't have to be like that, right? So it could be a lot better. And so when we started the project, and we got quite a lot of passionate people to come in, it was all about trying to change that mindset, also giving it a good service and good facilities. I think with the problem of saying that, is there enough quality care? Is there a change in paradigm? And it affects all of us. So you jump into that. And then when you get into, in anything, right, you go into any industry and then you find that, actually there's a few things hurdles. So one of the hurdles, I think, for Malaysia is that we're still a very young nation. So when the conversation that we have about aging and the awareness of, seniors, well, there are many layers. So maybe the first layer is about actually the community itself. Right? When we talk about aging, it's always a little bit taboo. I guess we talk about, where do they go if you need care, right? And that conversation isn't very easy to have until it comes to a situation where it's very stressful. Let's say even if you had a stroke or something in the family, the whole family has to get together. So that conversation either can happen earlier, or if the awareness is not there, then you also have to kind of convince people that, actually you should be thinking a bit more long term.
So I want to take you back to this whole thing about quality of care. Could you expand on that?
Sure. So quality of care is something that, there are also different layers to it, I would say, right? So quality of care, of course, is about accessibility, right? And also about how you get treated. So the basic thing is that you require some care. So we have this term called ADLs.
ADLs,
yes. Activities of daily living.
Okay,
yeah,
nice.
So ADL. So what it means is that you would help someone on the basic care. So things like helping bathing, feeding, showering, and things like that. So that helps on the mobility part of it. So important that when we talk about quality of care is actually to make sure that it's done in a very respectful way. That it's not just about the medical side. So a lot of the conversations about quality of care is very medical, it's true. But at the same time, there's a lot more than that, right? So when we mention about care, you also have got to make sure that the respect is there, to make sure that, the carer, when they're taking care of someone, they also respect their wishes, right? Those are very fundamental things as well.
Right.
So that has to look in totality. And then, of course, there are more than just to talk about the fundamentals, but also about how they feel.
Right.
Those are
Right.
important too. Yeah.
So the key highlights today was walking through the space and seeing how much dignity was shown towards the residents. The whole house is designed to actually facilitate 360 well-being, right? There were places of art facilities where they could do art. There were places outdoors where they could do exercises. There was a gym and also a huge kitchen to ensure that they were eating well, every day. Another highlight was meeting Nurse Azila, who spoke about why she was working in an assisted living community rather than working in a hospital. And she said that the feeling of family and how she's grown to actually really care for all the residents there, and they've become this family unit, which brings her joy every morning. So that was so heartfelt and heartwarming. It was really, really great to see how communities can be built in a way that gives dignity and respect to its residents. Good afternoon. Thank you so much for agreeing to be part of this interview.
Hi.
Could you introduce yourself?
Yeah, my name is Noor Azila binti Cik Abdul Rahman. I'm qualified nurse and graduated from Tun Tan Sri Lok College of Nursing and started my journey as a nurse in Asunta Hospital.
Oh, Asunta Hospital.
Yes.
It's a very lovely hospital. So kenapa Cik Azila tukar jadi nurse di aged care?
Saya tukar kepada aged care ni sebab ingin mencuba sesuatu yang baru, dan dalam masa yang sama saya juga mempunyai nenek yang sudah tua, dan dalam masa yang sama kita menjaga mereka ni seperti keluarga sendiri. So daripada dekat hospital, setting dia lain sedikit, dan bila dia di sini kita rasa lebih macam rumah, dan kita boleh bagikan kasih sayang bukan sahaja dengan orang tua, dan juga kita juga boleh bersama dengan dia punya keluarga untuk bersama menjaga orang tua di mana mereka tidak dapat jaga di rumah, dan kita providekan boleh jaga di sini.
So banding dengan hospital, stress level dia macam mana?
Banding dengan hospital tu dia berbeza sedikit. Bila di hospital semuanya ada, tapi bila di sini benda tu agak limit. So kita kena jaga dari segi kesihatan mereka, dari segi macam pemakanan mereka, dan juga kesihatan mereka kalau mereka tidak sihat, apa yang kita patut buat. Sebab kita di sini, kita bukan hospital yang ada semua benda. So if let's say kalau dekat hospital tu kita ada everything, kita ada doktor on the side. Ya, tapi dekat sini tak ada. Kita hanya ada doktor seminggu sekali.
So adakah apa cabaran bekerja di sini?
Cabaran tu ada macam sekiranya dia melibatkan emosi, macam mana kita nak handle emosi tu bila mereka down, bila macam mereka tidak mau makan, ataupun mereka rasa sedih, macam kehilangan seseorang yang mereka sayang. So kita kena bagi comfort dekat sana lah. And dia bukannya hari-hari berlaku lah. Ada masa kita akan gembira, ada masa mereka down, kita akan sama ceriakan mereka, dan dalam masa yang sama kita rasa macam mereka tu bukan orang asing. Tak kira lah kita ni tak sama budaya, tak sama agama, tapi di sini kita anggap semua sebagai keluarga.
So macam mana mereka sekarang suka bergaul di antara orang lain?
Ada yang tidak, ada yang bergaul. Macam contohnya bila mereka bergaul, kita akan libatkan mereka di dalam aktiviti seperti macam di mana mereka akan melakukan craft ataupun lukisan, ataupun kadang-kadang mereka menyanyi bersama, main game, sebegitulah.
So dalam satu hari, apakah blok aktiviti yang mereka menjalankan?
Setiap hari aktiviti tu adalah berbeza. Ada masa kita akan main board game, ada masa kita akan main macam bingo ke, ataupun ada masa yang sama kita akan melakukan craft atau melukis.
So dalam segi kesihatan aged care, apa kepentingannya aktiviti-aktiviti ini?
Aktiviti ini sangat penting untuk mereka sebab dalam masa yang sama mereka akan kenal semua orang dan mereka tidak rasa ditinggalkan bersendirian. Bila mereka bersendirian, di situlah mereka akan rasa sedih dan diorang akan rasa macam tak ada orang sayang mereka. Sebab orang tua ni dia berbeza compare dengan orang yang muda. Seorang muda boleh bawa diri. Bila orang tua ni, kita lebih suka mereka akan ingat kepada anak-anak mereka, especially yang bukan tinggal dekat Malaysia, ada yang tinggal di overseas. So kita akan make sure that mereka akan rasa gembira dekat sini.
Bagi saya satu gambaran aktiviti sehari.
Sehari, okey. Pagi kita mulakan dengan aktiviti di sini, di mana di courtyard ni kita akan melakukan senaman pagi. So selain senaman pagi akan dikondak oleh saya punya physio staff. Dia akan melakukan dalam 45 minit macam tu, main sama-sama dengan mereka, dan dalam masa sama caregiver pun akan tolong juga. Selain daripada main bola, sepak bola macam tu, dan dia akan melakukan regangan. Dan dalam masa yang sama, bila dah habis, ada masa mereka akan borak sedikit, dan lepas tu kita akan bawa mereka ke bilik. Dan mereka akan, macam di zone A kita ada TV launch sendiri, di bahagian B dengan C kami sharekan. So di zone C memang tak ada langsung lah, so mereka akan duduk bersama dan menonton televisyen sampai masa macam mungkin mereka nak air ke apa ke, so kita akan buatkan untuk mereka sampai untuk lunch, dan kita akan bawa mereka ke lunch. Dan bila habis lunch, macam biasalah rutin mereka pergi ke toilet, mau rehat sebentar, dan bila pukul 3 adalah mereka punya makan macam tea time macam tu, tea break. Dan kita akan lakukan aktiviti dalam pukul 3.30. So 5.30 adalah mereka punya makan malam, dan selebihnya mereka akan rehat dan tengok TV lah.
So di sini ada berapa nurse?
Nurse saya dan juga seorang lagi nurse lah, Rabiatul, tapi dia masuk petang.
So ada 2 nurse, lepas tu berapa caregiver?
Dalam 15
caregiver lah. So satu patient berapa caregiver?
Dalam 1 tu 4.
4. Okay. So okay lah, then it's all there. Keluarga mereka boleh tiap-tiap hari visit ke?
Saya encourage mereka untuk datang supaya mereka tidak rasa ditinggalkan. Sebab bila mereka masuk di sini, benda yang penting yang saya akan bagi tahu, datanglah melawat mereka dan bawalah mereka keluar, ataupun keluar seperti bawa mereka di jalan-jalan, pergi ke taman, pergi ke mana KLCC mungkin. Just bagi mereka rasa happy dan dia rasa anak mereka masih sayangkan mereka.
So nice. So what gives you joy here?
Their happiness is my joy.
Your happiness is your joy.
Yeah, because if they're sad, I feel so sad too.
Adakah apa cabaran dalam industri yang makes you frustrated?
Kadang-kadang mereka tak faham.
Mereka itu siapa?
Macam orang sekeliling. Kadang-kadang macam kita nak explain, ada yang relatif yang ambil masa untuk faham macam keadaan, ataupun orang luar yang macam tidak faham dengan apa yang kita lakukan dekat sini. Mereka ingat kita just abandon je, tapi sebenarnya tidak. So kita kena explain, dan masyarakat pun sekarang rasanya mereka dah tahu kepentingan untuk menjaga orang tua, meletakkan ibu bapa mereka di pusat jagaan untuk jagaan yang lebih baik. Sebab ada yang masih ragu-ragu sebab nanti jadi apa-apa macam mana, macam
kadang ada kecemasan macam
mana. So kita kena explain in detail supaya mereka akan rasa lebih selamat nak letak ibu bapa mereka kat sini. Kadang-kadang mereka just ada orang jaga, tapi nanti macam mana,
tanpa was-was lah.
So saya nak mereka rasa macam bila mereka hantar tu, mereka rasa homey juga. So anak-anak pun macam free, bebas nak jumpa ibu bapa mereka. Macam tu lah.
Yang kanak-kanak yang kecil boleh datang sini tak?
Kecil, kita masih ni, tapi sekiranya mereka tidak sihat dan kami tidak akan membenarkan mereka masuk lah. Tapi sebab kanak-kanak dia lebih cenderung kepada kesihatan imun yang rendah, sama juga seperti orang tua. Kalau ada saudara mara ataupun anak-anak yang tidak sihat, kami tidak akan benarkan mereka datang kerana dia boleh menjangkiti. Dalam masa yang sama dia menjangkiti semua orang.
Okay. So kalau ada nasihat untuk nurse yang ingin mencuba aged care, apakah nasihat yang akan beri kepada mereka?
Jangan takut, anggap mereka seperti keluarga sendiri. Kalau kita lakukan kerja kita dengan secara jujur, ikhlas, kita boleh lakukannya semua. Sebab tak semua orang mampu nak menghadap semua jenis perangai orang tua dalam masa yang sama. Benda ni adalah cabaran dan untuk kita belajar, a next step untuk kita tahu apa yang kita lakukan untuk masa akan datang.
So what is the next step for you
For me,
dalam your career in aged care?
yeah, maybe I will open my own one
What?
in future. I don't know.
Okay.
Dalam masa yang sama, benda ni kita kena luaskan kepada orang, sebab bila ada yang mereka ingat kerja sini kerja senang, tapi sebenarnya tidak. Dia cabaran dia bila kita berhadapan dengan orang tua ni, dia tak sama macam kita dekat hospital, berlain-lainan umur. Di sini umur dah macam nenek kita, atuk kita. So nak jaga mereka tu is something like you have to be patient.
Right.
Kalau you tak patient, macam mana you nak jaga?
Tapi bukankah semua nurse dia memang patient kan?
Ada yang tidaklah juga, sebab orang tua perangai dia tidak sama. Ada yang masa dia akan show tantrum, dia akan really tantrum, and you really have to, sometimes you have to step back. Jangan trigger dia lagi. Kalau you trigger dia, lagi dia akan rasa marah dan nanti dia akan benci you apa semua. So kita tak nak benda tu. Nanti dia akan rasa lagi bila
ada dendam kan.
Bila orang tua ni dia akan ingat. So dia kata nanti I tak suka you. So nanti dah masa kita kena slowly perlahan-lahan ambil restu mereka balik, baikkan dengan mereka balik, sayang mereka balik, adakan balik hubungan yang rapat seperti sebelum ni. Macam tu lah.
So you semacam orang keluarga mereka lah. Yeah. Okay. Alright. Okay. Do you have any favorite patient or someone that makes you really gives you joy or makes you happy?
Okay, I do have one auntie which always call me pretty lady. Every time, everywhere, she will always call me pretty lady. Tell the family, this is my pretty lady, or this kind. So, she always be patient with me. Sometimes she shows some tantrum also, but there's a way to calm her down. Yeah. So, other is not say that I bias to others. No, everyone actually the same. I treat them equally. So, ada yang akan buat rasa nak marah tu, kita macam okay tak apa, jangan cakap banyak. Okay tak apa, kita step back sekejap dan okay tak apa. Yang favourite tu yang selalu lah good morning pretty lady. So kita rasa
ceramah lah.
Bila kita datang kerja kita rasa gembira, macam ada orang sayang kita, so kita pun kena sayang juga.
Betul kata you, orang ada sayang itu begitu important kan. Okay. Martin understood the 360 delivery of care. He also then talked about how he has training in the area, and you will see shots of the training being conducted for caregivers. Now, caregivers are not necessarily trained nurses. They just go to give care, and sometimes care means holding someone's hand as they're going through a tough day. Sometimes caregivers read to their patients. Sometimes caregivers just look after their daily tablet taking. I have a friend who is a lovely caregiver because she goes in and she takes down stories of the patients, and she goes in there and she basically writes down their biography for them so that they have a legacy to pass on for their children. And I think that sort of intangible care is priceless, and we really do need a whole community of caregivers to kind of rally around our aged community. One of the things that we like to do in governments, and for the sake of collecting data, is that we crunch everything into boxes, very convenient boxes, and we call them demographic boxes or economic boxes, right? So someone is either this age, earning this much income. Although it's very useful, demographics don't really help us understand who the soul of the person is. And for age living, one of the things that I heard that Martin brought up was that it's not so much how old they are, it's where they are in terms of their stage in life, right? So sometimes you could be 60, but you behave like you're 80. Or you could be 80 and behave like you're 60 because, you know, you love ABBA, you love to go out for dancing, you love to move your body, you have the same language or you speak the same language as someone 40 years younger than you. So we call that psychographic profiling. And I think psychographic profiling is much richer in terms of depth and dimension of understanding someone. And also then, if someone is psychographically aged 40, right, you would send a caregiver, an appropriate caregiver, to be her caregiver or his caregiver. You wouldn't send someone that was matching in age, you would send someone matching in psychographic profile. So I think we need to find a way to reduce all the lines and the boxes and open up all the boxes and kind of navigate the gray areas to really get to know the human and the soul behind the body. If you like the content and if you like this video, please hit the subscribe button. And because this is a passion project, it is self-funded. So if you really like to contribute, please buy me a coffee and the link is right below.